Hello and welcome to today's webinar, The End of Transactional Care Management, Orchestrated AI-Driven Outcomes. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screens on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Sundar Subramanian, CEO at Zyter TruCare, Sruthi Madhavan, Vice President of Strategy and Transformation at Zyter TruCare, and Ruchita Kewalramani, Principal for Health Strategy at PwC. And at this time, I'd like to turn the floor over to the speakers.
Thank you. Good afternoon, good morning, everyone. We're excited to get this webinar started, and we have a great discussion and agenda planned for today. I am Sundar Subramanian. I'm the CEO of Zyter TruCare. I've been doing one form of fashion, payer work or services work or product work now related to healthcare in the last 25 years. Shruti?
Hi, I'm Sruthi Madhavan. I'm Vice President of Strategy and Transformation at Zyter TruCare. My career has been focused predominantly on reimagining operations for payers and providers. And at Zyter, we help not just talk about AI, but really help drive sustainable outcomes. Really excited to be here and talk to you about all the cool things that we're doing.
Ruchita, Kewalramani. I'm a principal at PwC Strategy and Division, and I'm responsible for driving our strategy initiatives across health plans and integrated systems. I spend all my time in clinical services, all the way from care model design, transformation, things related to how you enable your systems to drive efficiency with your clinical staff, and just overall betterment of clinical operations, both at payers and providers. And excited to be here with my old colleagues today.
Thank you, Shruti. Thank you, Ruchita. So with that, we'll get to the agenda. I'll do a very quick overview of who we are and what Zyter offers and is in the business of doing. Ruchita is going to share some industry trends and where she and her practice sees as key things happening for payers and providers in the space. And then we will have a discussion around sustainable transformation, which is how do you really embed AI? How do you really bring product and technology and AI to reimagine process that Shruti will start talking about, and then we'll do a quick panel discussion. Feel free to put your questions in the chat, and we will address as many of them as possible as we go through the next hour. So with that, let me introduce Zyter real quick. So we are a scale clinical platform, right? So we do end-to-end care management, disease management, utilization management, medical management for RX, and provider authorizations, appeals, the full gamut for any risk-bearing entity on managing clinical and medical costs from UM/CM, DM, all the way across to end-to-end PHM and care model capabilities. We also bring an artificial intelligence platform that is embedding AI end-to-end in these clinical workflows, which we are very excited to talk about today. We have 45 plus health plans on our platform, and we've received a lot of awards, and we serve all the lines of business, right? We have scale membership in Medicare, Medicaid, ACA, and commercial, small and large group, and providers and ACOs. And more than just the awards, the recognition goes to really what we're excited about is the client impact we are able to drive. Speaking of which, real quick, we just there's this rating that even Everest is coming out with this week, which starts to show the highest client impact score for all vendors that we've received, which we are very excited about, which really is backbone of which is driven by how we are embedding AI and interoperability and enabling clinicians to operate at the top of the license, which we are excited to talk about today. So if you go to the next page, at the heart of it what Zyter does is we have a digital core platform. It's called TruCare, and that's where we have more than 45 million members, and the end-to-end workflows and UI for clinicians, and a collaboration capability between payers, providers, and members to reside in one system to really collaborate on a holistic care model. That's our core digital platform. But we also have this agentic platform where we have now 40 plus agents, AI agents that are orchestrating workflows and enabling clinicians end to end, and really helping them automate manual tasks, but also bringing predictive model and suggestions and recommendations and summaries to help them practice at the top of their license, which we're very excited to embed within the digital core platform and drive an end-to-end experience. But we also have a clinical services arm where we have clinicians, nurses, MDs that actually do use the platform and do the work as well. So what we live for is how do we simplify operations? How do we help clients simplify operations and really amplify clinical outcomes and total cost of care, and go at risk where appropriate to align incentives to drive that kind of a model for our clients. So that's what Zyter is about. With that, I'm going to turn it over to Ruchita to share some market perspectives, and then we can go deeper into how do we envision driving transformation using these kinds of capabilities.
Thank you, Sundar. Really exciting times for Zyter ahead with all the innovation that you all are driving. Maybe just for me to sort of hit on some of the industry trends and why this is such a critical time in how we enable clinicians, right? Like, the quest for affordability in the industry is really heightened. When you think about, we had 7.5% medical cost trend going into 2025. We are projecting 8.5 going into 2026, and some others are projecting 9.5 going into 2026. So that's almost 3 times the wage increase. And it is, going into 2024, we had seen increased utilization and increased MLR for the Medicare Advantage population, where sort of a lot of seniors were showing up with not only an increased incidence rate in critical conditions, but also a higher acuity in the population. That is not just in Medicare Advantage anymore. In 2025, we are seeing heightened medical cost trend both for ACA, Medicare Advantage, but also for Medicaid and the commercial population, where when you think about cancer rates, diabetes, other conditions, much more predominant, and the cost of care has been increasing with that. Along with that, the industry is also experiencing lower revenue. So from a stars rating perspective, as you see distribution of different plans and the amount of lives that they have across 5-star, 4.5, 4-star rated plans, that has been dipping year over year. And then with a fully phased in version 28 of the risk adjustment model, risk scores overall in the industry have seen a significant dip. There is sort of increased utilization, higher acuity of patients, higher incidence rate, and then a decrease in revenue that creates a perfect storm for our health plans. And along with that, if you even read some of the labor reports, a lot of hiring has happened in the healthcare sectors. Actually, like the last report said that 3/4 of the hiring in the last quarter happened in the healthcare sector. And that's all mostly in care critical roles that are really important in delivering care for these patients as they show up in these care settings. So, the payers, providers, all are feeling the squeeze from all sides. And then comes HR1, where it's going to take out $1 trillion out of healthcare in the next decade. So where do health plans as well as providers go? What we are seeing in the industry is a lot of optimism in driving AI-related models, in really creating this efficiency in the clinical workflow, as well as for the clinical workforce in many different arenas. So we are starting to see much more intelligent Many of the use cases are around point of care and prior authorization, where when the patient shows up in the care setting, trying to do sort of a AI-based eligibility verification and point of care prior authorization to reduce burden on our most critical physicians who are delivering this care. So we are starting to see a lot of innovation at that end. We are also seeing AI-led medical necessity reviews. So if there is appropriate documentation that shows up for prior authorization for those requests, bumping that up against MCG guidelines through the use of AI and agentic models that gives the first review to agents rather than having clinicians do the first review. A lot of efficiency is being seen in ROI models that are proving out in the industry that would ultimately give a lot of relief to our clinicians. We are starting to see that as well. Even going upfront on or upstream on risk stratification, right? The historic risk stratification models were very much utilization based. So, many of the risk adjustment models, risk stratification models said if a patient has 2 or more acute events or is on over 5 or 6 concurrent drugs, then they are high risk, and let's go engage them in sort of, enabling our care model. Now we are seeing much more use of ML-based risk stratification models where you can take over 20, 30, 40 factors of like their age, their nutrition level, where do they live, their zip code. You could take a lot of different factors and create cohorts of population that look different from each other, which means their habits are different, their behaviors are different, their engagement rates are different, how they engage is different. And so starting to sort of unlock the value of ML to drive risk stratification and really understand the nuances of population and enabling population health in the right setting for the right caregiver is pretty critical. So we are super excited. It creates a lot of tailwind in the industry with the use of ML, with enabling your clinicians, with driving appropriate care at the right setting, with the right nudges, with the right incentives, and really unlocking AI to enable a lot of this that would ultimately give health plans, providers, release in admin dollars as relief in both admin dollars as well as medical dollars. So super excited time for the industry. We've never seen something like this before where everyone's talking AI all the time. So, from a PwC perspective, just sort of driving a lot of those conversations and truly getting to the heart of the matter in how do we use these models to actually get cost out of the system. That's ultimately the goal. And, we're excited about this partnership here. Shruti, over to you.
Awesome. I think that's a perfect setup to now begin talking about like, hey, what is Zyter really doing to help with this problem? I don't have to tell you all, right? But the current functions within payers across back office, middle office, it's highly manual and it's very fragmented. And there has been a lot of investments over the last few years where we really look at, hey, what are the manual processes? What are some things that we can automate? But at Zyter, what we believe is point automations are not really going to drive sustainable outcomes. We need to look at processes end to end and figure out how we can reimagine the work in an AI first world. And we believe the future will have 4 important components of your operations. One is a highly automated, intelligent end to end workflow. 2, how do we embed analytics and decision support so intuitively that it really surfaces and empowers people who are driving care decisions? 3, how can we have an omni-channel engagement that is more proactive, not just payer provider or payer member, but across the ecosystem? How do we enable that stakeholder communication? And finally, how can you have an integrated care team? Ultimately, we are serving one patient, but we can't have 5 different siloed functions trying to solve at the same time. So our objective is how can you enable whole person care while also driving sustainable cost savings? And if we really look at the future state that we want to enable with our vision, we think about it as 3 different layers. So the bottom layer is like, how do we have an interoperable digital foundation? So we all have legacy systems of data, platform, and even like point solutions that we've been investing in. So how can we enable a layer on top of it that enables this AI workflows without doing a lot of work on the existing ecosystem. So how do we have something that is AI native, integrates with your enterprise architecture or tech stack? And then two, how do we enable this orchestrated workflows that we talk about? So in your future, your operating model is not going to just have humans. It's going to be a combination of AI agents and humans. So how do we create that operating model? How do we have that process? And how do we orchestrate that across systems, teams with precision, and also based on real-time context and cues with appropriate routing and escalation as needed? And finally, like it's really important to have an AI augment experience. So how do we really empower anybody who is using that platform with a guided workflow, with an intuitive dynamic UI, and that drives the next best actions? So this is kind of what we really strive forward. Now let's do a poll.
Great. And our poll question is, which outcome is your top priority to drive in the next 12 to 18 months? A, cost savings, B, productivity gains, C, improved clinician experience, or D, enhanced payer-provider collaboration? We'll leave that running for a few seconds.
I'm sure a lot of you are hoping for multiple choice when it's a radio button. Okay.
Results are in.
Awesome. Looks like a lot of you all really want cost savings, so that's 50%, followed by productivity gains and clinician experience. I'm just surprised nobody has picked payer-provider collaboration, but we can talk about that, right? I think that is ultimately the overall stakeholder experience. But what if you can actually get all of these outcomes? So what we truly believe is with an AI orchestrated workflow across any function, you would not only be able to like drive cost savings, but also be able to drive some of these other outcomes. And that's what, you know, our product really helps accelerate. Let's take a couple of examples. So let's start with a workflow. So in the current state, you have a prior authorization intake coming from any of the channels. Somebody manually enters the authorization details. Can you imagine in 2025, somebody looks at the document, writes all of these things to create a case, goes to different systems to review the benefit, see if they are eligible, looks at the provider status to see if it is in network or out of network. And then somebody manually attaches the clinical documentations to a member's chart. And then finally, when it gets to a clinician, they review the authorization request. They review their medical records. They review the guidelines to see what is the best guideline that they can select between MCG, Interqual, and also reviewing, comparing all of that to create the checklist to determine whether it is a medically necessary procedure or not. And in the past, you would look at each of these tasks to see like, okay, let me automate one portion of it, right? But when we really think about it as an AI orchestrated workflow, in the future, it becomes how can you have a group of agents that are running behind the scenes and based on the real-time context and cues, does all of these things. So there is an agent getting the intake, creating the case, agent checking the benefits, going to different systems, sources, bringing that information together, an agent picking the right guideline, creating that checklist for you, and pulling together a preliminary recommendation and summary for a clinician. So the case starts with a clinician receiving this summary from the agents and reviewing it and really doing the things that they are required to do or supposed to do as part of their license and making that determination. So, something that was done in 90 minutes can be now done in 15 minutes. You're getting the productivity gains, you're getting the cost savings, you're increasing the accuracy, and you're also increasing the experience that everybody receives in the ecosystem. Just to give some visual example of how this will look like, this is a version of, hey, you have a prior authorization, right? Clinical guidelines are automatically selected. you can see the checklist being created on the left-hand side, and AI automatically identifies what are some of the checklists that are met and what is something that is pending, it is not really sure about. And this is the summary that gets presented to a clinician who can then quickly compare, look at the documentation to make that determination. But we ultimately want the decision rights to be on the clinician. We don't want the AI to make the decision, but we want AI to help the clinician with all of the information to then take the decision. So the clinician is then empowered to change the guidelines if they want, compare it across the different guidelines, and the AI quickly recalculates it based on the selected guideline. They can look up all of the records, documentation. So in the experience that we are providing for the clinician, that is critical, right? So you're giving the summary and recommendation from the AI, but you're also empowering them with information that they can use then to make the decision themselves. Now, let's look at the care management side. So similarly, in the care management world, you get a manual referral. Somebody has to manually look at benefits eligibility, and then they have to manually reach out to members for consents. And then when a nurse gets it, nurse would look at the members chart to understand the referral reason. If they have to do some of these assessments, they outreach to the member, do all of the assessments, manually look at the care plan library, build the care plan, document all of that. So it's almost like a 2-hour process that they do currently, right? And most of this completely manual. But in the future reimagined version, I keep saying future, but this is currently something that we should be able to do with our product. So in the future workflow, everything is done automatically. So they have an automated library of care plans that they can drag and drop. AI gives you the recommended summary, and all they have to do is validate it, do a quick assessment, call them as needed, try to create that summary. Like all of this happens in 30 minutes, and the work they do is actually the work that they want to do. So that's kind of the future that an orchestrated workflow can paint. Just to give some visual to care planning. So this is a visual of like how do you have the automated care library created. On the left side, it's drag and drop, and then on the right side you can see for the particular condition, AI automatically recommends the next best action, the care plans, what priority each of these things are. So this is what a nurse gets, and they can decide whether this is something that needs to be part of the care plan, or they can drag and drop, update it with anything that they think is the most relevant one. So all they have to do is do this and submit it, which is faster than what it would be otherwise. So let's get into the next poll question.
Great, and you'll see the poll running on your screens now. Our poll question is, what is your biggest concern about enabling AI in clinical workflows? Loss of clinician oversight, lack of transparency / explainability, data bias or inequity, workflow disruption / added burden, or no concerns? Thanks for your participation.
I think this really gets into, yes, everybody is talking about AI, right? But there are some challenges that come with it as well. So most of us are really apprehensive about how we want to leverage it. What are some of the guardrails that we will have to put in place to make sure we are enabling it the right way?
And our results are in.
Okay. The polls never seem to surprise me. I'm just immediately looking at no concern, 17%. Great. But I can also see, it's an equal distribution between, loss of clinician oversight, transparency, and, the bias and inequity. So just wanted to, talk about a study that, Zyter did in partnership with Mayo, but also really holistically thinking about how do we build trust with the clinician, right? What is the best way to introduce AI to a clinician so that it really helps them, but also enables that trust? Starting off with transparency and explainability. So providing clear rationale between, what are the AI outputs, what really went into them, and how was the decision made. That really shows that clinicians don't override such decisions. They take into consideration if an AI provides that with rationale. And also emphasizing on the confidence calibration. So how do we make sure we build that confidence equation so that a clinician knows, okay, if it is above 90%, I can trust it, versus if it is in this range, I need to do a little bit more insights into it. So enabling these two, our study proved that really reduces the overrides the clinicians do when they are selecting an AI recommendation. Other than that, thinking about, like, if you look at the end-to-end workflow, you need to think about what are some of the units of work the agents can do, and what is some of the critical decisions points that a clinician needs to be part of. So designing that to make sure that there is a human oversight and the final decision maker is always a clinician really helps build the trust as well. And also, while you're tuning your data models or AI models for your data, making sure that the inputs are really diverse and thinking about all of the guardrails on biases to make sure the decisions are always equitable. And most importantly, rethinking the governance and accountability. Right now, our governance frameworks usually do not have, how do we make sure a decision taken by an agent is who is responsible for that, right? So really thinking that through and having a governance and accountability that includes the operating model where a human and agents are working together and learning together, that is very critical. That wraps up our presentation, and now we would love to get into some of the questions and have a good discussion.
Great, thank you. So at this time, we're going to address some questions that came in during the presentation. The first question is kind of a three-part question. In what functional areas are health plans making AI investments? How substantial are these investments? And where does care management or population health management stand as a priority for AI investment? Ruchita, do you want to weigh in on that one first?
I'm happy to. Pretty critical question, and an interesting one, just as we think about some of the budgeting cycle that we are seeing going into 2026 as well, with both health plans as well as health systems. AI remains sort of number one discussion as we are seeing some of the budgeting conversations for 26 in an investment all across the value chain, from customer acquisition and top of the funnel, driving consumer engagement, to clinical services, to back office. I think there are a few different use cases that dominate the conversations right now. The first one is, how do we use agentic workforce in our call centers, especially when you think about the call volumes that come in that remain pretty high for low value questions, right? Things like, am I eligible for this service? Is this service covered by my health plan? And what would be the cost of this service? And that is clearly something that an agent-based workforce can drive, that can sort of have a conversational upfront, drive eligibility verification through AI-based models, engage with the patient, and give them the answer in a much more efficient fashion. So call center remains a pretty significant use case. The second use case that we are seeing a lot in the market is around and prior authorization. When I think about the dollars themselves, I don't know any health plan or health system that is not sort of spending somewhere in the neighborhood of 10 to 20% of their investment portfolio in AI-based models and AI-based investments. So pretty sizable investment going into these. I would say, any medium-sized health plan is probably spending north of $100 million in these models. So we're seeing a lot of investment in a lot of different use cases, trying to drive efficiency for the clinical and non-clinical staff in these operations. So, is there anything you want to add?
Yeah, I mean, just to amplify, I think it's about where the complexity and the costs are, but to go back to the points that started the problem statement you described, which is really around affordability, the extreme affordability challenge that the industry is going through. I think the ROI is pretty significant to go solve for that. And all the things that I think you talked about, and Shruti talked about on point of sale authorization, but medical review, risk stratification, next best action, and really care planning and ongoing contacts with members and providers. All of that needs to be tackled in a pretty end-to-end fashion with AI to really get at the heart of this affordability challenge, right? So that's kind of where it seems like the ROI would prioritize itself.
Great, thank you both. Our next question is, can you share examples from health plan senior executives on how current market or homegrown AI solutions are not adequately addressing their financial or operational challenges?
That's a
Ruchita,
great
you want to
question.
start? Go ahead.
Yeah, I can start. I mean, the debate remains pretty heated on which AI models to use. And as you can imagine, sort of, there is upskilling that is happening at many different health plans as well as health systems in wanting to have a labor force that is sort of well versed with AI models. A lot of sort of larger vendors, when you think about sort of some of the pretty significant tech companies, have also sold the idea of, hey, use our platform, use our solutions, build your own sort of solutions and sort of drive innovation in your workforce. I think there is skepticism amongst executives if the right path to use these models is an internal build versus vendor solutions. I think right now we are seeing a lot of spike in interest in vendor solutions. And there is sort of with that, there's a lot of noise in the market as well. So we are seeing a lot of debate on like, show us the ROI. We are interested in vendor solutions. Many different instances, we are also seeing executives ask vendors to put some skin in the game that if you think your AI models are better than what we can build internally, show us at what price point and what ROI and outcomes can you drive, and let's partake in the benefits of the outcome. So, some interesting dialogue at the top of the house around, should we build internally? Should we go with vendors? If we go with vendors, can the vendors actually truly drive outcomes, and are they willing to put skin in the game? And some exciting math going on and focus in the industry around that.
Yeah, I think those are really good points. I just, what comes to mind is this, I think this recent MIT study that sort of created a stir on 95% of pilots are showing that the AI solutions are not really delivering value, which is a very startling number given the amount of, studies and efforts that are going on in AI. And I think I would really think about this is that really that the AI solutions are not adequately addressing specific needs, or is it that we're using AI solutions to solve kind of bad process issues? So you automate bad process, kind of a we've all been through the RPA journey. It did create some value, but not quite enough as the industry expected to not repeat that movie. I think I go back to many of the solutions are just trying to automate point solutions, trying to automate points in the process, which create more silos and do not quite create an end-to-end experience. And so solutions or platforms that can integrate these solutions will stand to be delivering much more value, and client efforts that look at the processes end to end and then embed solutions to redefine the process end to end will add a lot more value than these individual point solutions themselves.
Great, thank you so much. And our next question is, which LLM or Gen AI model are you using for your AI initiative? For example, like Gemini, etc.
Yeah, I mean, I can take that. Our product, we actually have a platform orchestrated, and it actually allows for multiple LLMs to be tested and more on a context and purpose specific basis, test which has better results to deploy. We are using a lot of OpenAI tools. We are also using Gemini as the most prominent two, but I don't think any one LLM is going to solve all problems. It's better to have a very systematic approach to test specific problems, which models work better, and how to embed them with a more hybrid approach.
Great, thank you for that question. Our next question is, for a health plan interested in AI-driven efficiencies, but hopeful to avoid reductions in force, how do you see AI-driven models having a positive impact?
I can take that one. Very close to heart for me. I think we certainly see a lot of low value work that is more administrative in nature that unfortunately clinicians are driving that prohibits them from working top of license. I'll talk about sort of case management and care management. Sruthi talked a little bit about when a case is flagged either through risk stratification or came in through a referral and is selected to be engaged in care management. A lot of times, case managers and sort of workforce managers are sitting there building queues for the clinical workflows, assigning cases to nurses, using their judgment in who to send this to, how do you manage caseload between your workforce, how do you drive productivity, and a lot of that can be automated within the clinical workflow. So work assignment, intelligent queuing, diagnostics, and being able to read the EMR that was notes that were appended to a case that came in. We are seeing sort of first pass reviews of a lot of sort of and prior authorization cases that are coming in, AI-led analytics that otherwise truly manual workflows and analytics existed, as well as member targeting, eligibility verification, all of those things being done much more with the use of AI that helps clinicians actually use their time in engaging the patient, using their license, building care plans, putting the patients on the right path to make their care health outcomes better. So exciting times for clinicians, and we are seeing a lot of sort of clinicians embrace that, which what it does is it helps you reduce your workforce and drive sort of the workforce in a direction where they can do a lot of high value stuff. So that's where we are seeing either better ROI on the workforce or reduction in workforce as well, that ultimately drives sort of margin relief for plans and systems.
Yeah, I love that perspective, Ruchita. I think to me, I feel the real cost of manual work in UMCM is not the administrative costs, right? It is actually the care outcomes, like, the delayed decisions, the missed intervention windows, or the preventable, readmissions. So all of that to us are the cost. So when you're leveraging AI, you are definitely solving for all of them, not just the administrative side of it.
Well said.
Great, thank you. And Sruthi, I think this question is directed to you. Where can a health plan start with AI solutions, and what might be a good rollout evolution path of AI solutions over time?
Great question. I'm going to answer it as two different sections, right? Like one, thinking about like, hey, in your current state processes, where do you want to start? And then two, touching more on like, hey, if you're implementing it, how do we want to start? So answering the first part of the question, it's really looking at your current state processes, like whatever you're selecting, you're prioritizing. If it is a pilot, like to Sundar's point, you really want to make sure you're choosing something that shows that tangible outcomes so that you can scale. So I would look at it as like across your current operations, what is something that's a quick win, but still an end-to-end workflow that you can solve for, show immediate outcomes that you can then scale it across your other operations. And then second, it's easier or it's very tempting to hey, I have this manual process, I need to like quickly find an AI solution to solve for it. My suggestion would be to like take a step back, think about like, hey, if I were to redo this in an AI driven setting, what would that really look like? So start with reimagining your current state work instead of just automating existing processes. Like if you automate bad processes, you're only going to get bad things done faster. So I would really take this as an opportunity to like invest in doing that process redesign upfront.
Great, thank you. And our next question is, every product slash app in servicing and CM slash UM are offering AI, Gen AI features. What are you seeing the trend? What do you see trending in the market? And is it evolving towards agent-to-agent orchestration and not all the AI agents from a single platform? Sundar?
Yeah. Sure, I'm happy to take it. It's a great question. I think part of it is there are specific tasks in these processes that there are many agents coming up and that can solve the problem, which immediately, similar to the RPA wave, creates a lot of complexity on like then should it be that different people are developing different agents and how will that work together? So first of all, we are seeing a very rapid proliferation of agents solving simple problems, very specific problems, like for instance, intake of faxes to convert the documents. But also, uh, in order to get to ROI and the kind of process and the results that Shruti was talking about in an end-to-end care management or the point of service kind of authorization that Ruchita was talking about, you do need to an evolution towards agent-to-agent orchestration and or master agents orchestrating multiple of these agents, and that all of these agents that are being orchestrated with the master agents may or may not be from the same company, vendor, or even in-house development. And it could be that you have a best-in-class kind of agents and through the governance and the testing process on the framework like Shruti was talking about on confidence and explainability, there may be agents from different platforms and vendors that could be good, but you should consider having a master agent framework and a platform that orchestrates across these individual agents and with a specific protocols, A2A protocol and MCP protocols that are evolving as standards in the industry used to orchestrate all that.
Okay,
Yeah,
great.
it's almost like a recruitment for agents, right? Like just like how you recruit like high talented humans, you need to create a recruitment framework of like, hey, what is the best agent? Who can I?
Great, thanks everyone. And our next question is, can you describe any of your implementations that leverage AI?
Sure, I'm happy to. We are working in multiple pilots and implementations with AI being embedded. The simplest example I started to describe, just to start a simple example that can give a lot of lift, but it is a specific problem. There is still a lot of paper and unstructured documentation and writing that goes on in healthcare. So OCRs have traditionally been able to automate only structured forms, and unstructured writing, faxes, or otherwise have not been able to evolve into a more consistent automation. And there are agents that have evolved to really tackle this problem. We are working, our own fax automation intake agent is able to automate 90% of that kind of unstructured documentation and with very, very high accuracy. So that's a very simple example that's getting embedded in most workflows today. And a more complex one is when you look at products like post-acute care or care management specifically related to higher risk populations. We are embedding AI end to end in the process by anything from automating of the aspects and the medical necessity reviews, automating the the risk assessments, getting more broader through predictive and ML models that trigger care plan design and next best actions, and also outreach, right? Which is really connectivity and asynchronous communication and peer-to-peer communications between even docs to review cases. All of these can be set up, automated, or simplified quite a bit using AI, which we are doing right now.
Okay, thank you. And our next question is, why do AI initiatives often disappoint or fail? Ruchita, do you want to speak to that one?
Yeah, absolutely. I think we are very much at the start, almost ground level of where AI can take the industry. And so when you think about sort of, ground zero, what happens is that Sruthi talked a little bit about this, that instead of jumping into actually reimagining the process and rethinking how work needs to happen, a lot of energy is going into, oh, this is our process, let's automate the process, which is a bad starting point. I think there is also this piece on lack of true alignment and understanding what is the outcomes that you're driving to. And will these models help get to that outcome in a new spot, or are you getting to the same spot just with the use of automation? And then lastly, I will say that the governance processes also create a lot of confusion in the process. So, right now, a lot of the industry is around this use case palooza where this use case, that use case, can we do this, can we do that? And it's creating a lot of noise. And a lot of sort of missed opportunity because there is no upfront alignment and reimagining the processes. Where we are seeing better outcomes is actually taking pen to paper and saying, how should we do this in the future? How do we reimagine this process? Does it need to look like the old process? What are the choke points in the old process? How do we solve those? And truly looking at it from a point of transformation and driving transformation in our clinical functions rather than let's just automate what we have. And so, unfortunately, a lot of energy around automation without actually reimagining is why we are seeing some disappointments. However, our clients are really smart. They're all learning from their mistakes, and there is a lot of optimism in wanting to do it better in the future. So, some effort and energy going into we've learned from our mistakes. How do we not make those again?
Thanks, Ruchita. Our next question is, what are your perspectives on effective implementation and operation of AI governance, including responsible AI principles and the reimagined care management processes?
I can take this one. I know, Ruchita, you covered most of the critical items for this one, but just to add to that, I think when we think about implementation of any of these things, yes, you need to like redo and reimagine your processes, right? Like rethink how we really want to do it in a steady fashion. But there is also a parallel effort that is needed to align it to your overall AI strategy and governance, right? As an organization, what are some of the guardrails that you need to have in place so that you don't take some of these decisions per implementation level, but you have it at an enterprise level? And then during implementation, you make sure that you're pulling from that as you are thinking about which AI agents and which AI models that you would want to enable. You need to make sure that there is an unbiased set of guardrails that you always have that helps you create the boundaries for the AI workflows that you're creating. And then there is also an equal importance in change management and AI adoption. And that is not just to like train the end users on how to use AI, but it is also to give them a broader perspective of impact of AI. What is responsible AI? Like what are some of the biases that they need to avoid so that they know how to leverage AI the best and how to evolve as AI evolves. So I think those are some of the critical nuances to keep in mind when you're actually implementing it.
Thank you. Thank you for the question. Our next question is concerning AI product testing and validation strategy. How are we going to confirm that the product is doing what it is intended to do?
I can take this. It sounds like a simple question, but it's actually a really good question because traditionally, when we think about implementations of software and of SaaS, testing has been thought of as, you have an expected outcome and whether we achieved that expected outcome. So it's a very deterministic thing to do testing and build make sure the product is working the way it's supposed to be, because most of the systems are very deterministic, business rules driven. But as we evolve into this AI space, which is much more statistical and generative, it is not as deterministic anymore. And what we talk about are two factors. Actually, one of our data science leads Dr. Jungwa, you recently wrote a publication along with collaborators from Mayo Clinic. He talks about transparency and confidence and testing systems and clinician acceptance of the suggested um, product or system recommendation versus overriding it, and what drives that, and how do you really go through a process of testing, and how do you set parameters around it. And I'll simplify the conclusion. It really comes down to two things. When there is very high transparency and explainability, so the system's built in a way that the it's not as hallucinating, but it's reasoning and explaining. It's, for instance, if there's a medical review, decision, medical necessity review decision being made, it's very clear about the branches of the decision making and the evidence protocol from guidelines that's used and why it's used. And the second factor is confidence. So the confidence goes associated with the recommendation when they're very high, and it's very straightforward. Then no, when both of those criteria are met, the adoption is very high. So working back to then what should be the way that one tests kind of these non-deterministic systems, it's to have first a sandbox to continuously evolve the design. When you get into the testing stage, that you can do parallel testings to drive high transparency and confidence on outcomes at a very high rate. So not even Six Sigma, but even higher before it gets into production.
Great, thank you.
Hope that helps.
Thank you so much. Our next question is, does this solution replace a medical rule engine, example, the Millman rules or CMS medical rules engine for pre-authorized clinical and coding decision making? Or will it still require such engines to be deployed in the workflow?
Yeah, I can take that. So it depends on the solution that you're enabling, right? So if you're looking at UMCM workflows, you would still need some of these other rules engine in place. But you can look to how you can best integrate with some of these things so that you're not duplicating the efforts.
Agree, and maybe I'll add, it certainly 100% agree with Sruthi. We are not seeing removal of these rules. Especially some of these are actually becoming much more applicable. So like even when we think about like the MCG guidelines or Interqual or others, a lot of automation is actually using these in taking the case criteria and the setting and bumping it against these rules to do a first pass on clinical decision, which then can be reviewed by a nurse or a clinician. So certainly seeing applicability of these into the clinical workflow. Because many of these are evidence-based, they're standard practices, and they allow sort of the use of these in just sort of a more automated fashion. So these will certainly remain.
And that will be our final question. Speakers, any closing remarks before we wrap up?
Yeah, thank you so much for the time you spent here. Hopefully that was helpful. I think there's a lot more we can cover, and I know there's more questions that came in. We can follow up individually, but just in summary, I think the space is changing a lot. There is a lot of there's clearly a need for solving for the affordability challenges, but also a better member and provider experience as healthcare participants work through automation and AI. And we look forward to working with many of you in this space. Thank you so much.
And to our speakers, thank you so much for that great presentation and for sharing your thoughts today. Thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again, and enjoy the rest of your day.